guys, how are you? I hope you're amazing. I hope you're beautiful. I hope you're blessed wherever you are. And I do hope that you're feeling a little bit lighter. If you are not, don't worry, it's not the end of the day. It's just one day that is bad. It's not your entire life. I promise you that. If today you're not feeling well, tomorrow you might wake up better. But if tomorrow you still are not feeling well, next week you might feel well. If not next week you're not feeling well, next month you might be feeling well. If not that, the next 5 coming months you might be feeling well, but trust me, it won't be the rest of your life. I don't think that reality would last for the rest of your life. Let me stop rambling too much. This is going to be a part 2 of my eczema journey and the medication that helped me combat the severe symptoms that I was experiencing, from the dryness to the itchiness to the pain to the discomfort and everything that I experienced. I thought that in part 1 that I recorded previously, I would be able to fit everything in one video. Unfortunately, I couldn't, because I took you guys extremely back when this started, which was about 2023, and then I realized that it wouldn't make sense to try fit everything in one video because it was a lot of information to take in. Then I thought, for the most important part of it, let's just separate it and then record a separate video, so because I feel like it deserves much attention. Number one, I think it's very important for me to keep emphasizing and reminding you guys that from where I'm standing, from the information I have and the knowledge that I have, I don't think that eczema has a cure. Like I said, it's an allergic reaction and you can react to anything anytime. I really don't believe that it has a cure. I simply believe that you can get a medication or a cream or an ointment or an oil, anything, you mention them all, in a cosmetics industry that can work in sync with your skin and help you combat the symptoms that you're experiencing, so that you can have an improved quality of life. So if ever somebody comes to you, in fact telling you that they are selling you something that is completely going to cure your eczema, I genuinely believe that you have to look much into it. I believe that you have to read more and equip yourself, or maybe go and talk to a professional, which also, please, this doesn't serve as professional video. Don't need. This is just based on my personal knowledge and my personal journey and my struggles that I had with the eczema journey. So let's get right into it. So now it's 7 months straight of straight suffering, no break in between, like I've been saying. It's 7 months of my hands constantly having blisters, 7 months of my body being extremely dry, 7 months of my body being in so much pain, in so much discomfort, 7 months of a shaken self-esteem, 7 months of a shaken confidence, 7 months of literally feeling like, my goodness, when is this going to end? Fast forward, I record a video on TikTok, it catches attention and it keeps gaining traction, like I said, and people started engaging with that video. And there was one lady who commented under that video. Her name was Sister Maureen, and she reached out to me saying that she wants to help me fight my eczema, and I accepted her help. The reason why I accepted her help was because, like I'm saying, from her profile, her name was Sister Maureen, and that immediately said she is in a professional space. She is a nurse. That's why she is referred to as Sister Maureen. And that made me feel better to understand that she is not just somebody who is trying to sell me their medication, or somebody who is trying to get visibility or marketing through me, but she is somebody who is genuinely going to be committed into my journey, because number one, she's in a professional setting, and I believe that nurses are meant to help people, and I understood that at that particular time I need support more than anything. I don't want anyone who's just going to throw me a medication and let me go, because anyway, that is what I had been doing for the past 7 months. And when that video started gaining traction, I had to stand still. I had to think really deep into looking at the type of help that I'm going to receive from people, and how that help was going to come. So when Sister Maureen reached out, I said, this is the type of help that I need. Why? Because it was going to come with the emotional support, it was going to come with the financial relief. Obviously, if she is giving me the medication, I don't have to buy it, at least when I'm on the trial stage, and at least that reduces the financial burden that I was going through of testing and trialing different medication that turned out not to work. But the second thing is the emotional support. At that particular point, I was so fragile that I needed somebody whom I can vent to. I needed somebody who would understand what it is, or what it felt like to be in my journey. And her being in the professional space and her dealing with patients every day gave me so much comfort to say you are in good hands. And indeed, with all of that journey, they were there for me, they supported my journey, and I will set the pictures of that here. So let us talk about the medication that Sister Maureen gave me. She gave me the medication Ilusan. I've said this before, that this smells very much like medicine. If you know how camphor smells like, it smells exactly like camphor. It has a lot of mint. There is nothing fancy about this cream. Like I'm saying, to me, it's a medication. And this says that it's a burn and wound medication. It is said that it creates a moist healing environment to assist with the osmotic properties of the following: cuts and bruises, diabetic wounds, psoriasis/eczema, leg ulcers, all degree burns, pressure sores, skin infections, and surgical wounds. Look, guys, I did not struggle with any of the things mentioned here besides eczema. I didn't have the degree burns, all right? I didn't have the pressure sores. I didn't have surgical wounds, obviously. I didn't have leg ulcer. All of the other things mentioned in this medication, I did not have. Therefore, I'm only going to specifically talk about the eczema, which was what I was struggling with and what I was going through. And the information that I'm going to relay here would be with regards to the eczema and how this cream then treated me. The first thing that I would say was this worked like magic when it came to relieving my skin from the dryness. Guys, I kept giving an analogy that, you know how your skin feels like after showering and you take long without creasing or lotioning your body, right? My skin would feel like that with me having applied a cream or having creased my body. I showered, I'm fine, I have applied a cream, but it would still feel like I did not apply anything for 7 hours. You would imagine that I constantly carried such a huge Vaseline. I think I still have it. Let me actually show you. Yeah, I'm sorry, I could not find that Vaseline, but I'm talking about the last number, like this huge Vaseline is the one that I'm talking about. I would constantly carry that and it wouldn't help me. If anything, it was making me worse. Like, the Vaseline is the worst idea. And I could see that when that video started gaining traction, a lot of people were suggesting use a Vaseline, use a Vaseline. I was like, oh my goodness, you don't know what you're saying. It was the worst thing, to a point that even on my mouth I couldn't use it anymore because my mouth started being painful, my mouth started cracking. So when I said that Vaseline Blue Seal did not help me anyhow, I mean exactly that. And no, I don't mean to damage the brand or anything of the sort. I'm just giving a commentary based on my personal experience and nothing more, right? So this helped so much in relieving the dryness. And so, because for the past 7 months I could tell that the main problem, even though I don't know much about eczema and I'm not educated like that when it comes to eczema, but I could see that the main problem was that I was struggling with dryness, and with that came then a lot of itching, of which if I scratched, I would gently sew, obviously, because I'm not a child who's going now to scratch the skin hard to a point of crackage and breakage. Gently sew, guys, but it would still get the cuts. This is, I don't know if you guys are going to be able to see them. I hope you can. You see that? That is a cut that I would get. 1, 2, 3, 4. Others are on this side. I don't know if you guys can see those sort of cuts. Those are the type of cuts that I would get just from the dryness, right? So this, I want to say, worked like magic when it comes to helping me with dryness, guys. It worked so much better. Now let us talk about my hands. My hands were affected the most, guys. the most part of my body that were affected the most. It looked like I was burnt. I am going to insert the pictures. And so because of that, Sister Maureen was worried that she would say to me that apply a thick layer of the medication, and I would, but she was worried that this thick layer isn't going anywhere, because obviously after that you're going to cover your body, you're gonna wear clothes, or you're going to sleep, and it felt like that medication was just then rubbing off on my clothes or my bedding. Then she came up with the idea of the bandages. I'm also going to insert the picture of myself with the bandages. So what I would do then is I would apply a thick layer of the medication in something so small. It's squarish like this. I don't know honestly what they are called because I'm not in a medical profession, but then you smear it on that small cloth, and then I would patch it here, and then I would patch the other one here on the most affected parts, and then I would wrap my hands, bandage them so that they stay intact, because they're the ones that were holding the medication, remember. So then I would do that, and then I mentioned that when I was going to work I would remove them, simply because I felt I didn't want eyes on me. I didn't want people asking me, oh, what is her problem with the bandages. I removed them because of that. However, I must say that if you are going to go for that journey of bandaging your wounds so that they heal a little bit faster, please avoid, more especially if you're struggling with eczema, and then you're trying to gain that moisture and retain it on your skin. Be careful not to overdo bandages, because you're going to experience what we call maceration. Maceration is when your skin gets too damp and therefore gets too soft, and with that it starts peeling off. You know the feeling that your skin feels like, oh, you know how your skin looks like when you've stayed in a shower for a long time, or when you've swam for a really long time in a swimming pool. You know how your skin looks like. It's exactly what you're going to get if you overdo these bandages. So we suggest that if you're only going to put them during the night, put them during the night. The following day in the morning, remove them and then shower. So then let us talk about what happened upon using this medication. So it's whitish in color. So when I would apply that thick layer and then bandage it, the following day when I remove the bandages and then I shower, I would take really long time to remove the most of the medication. So that whitishness would really just be stuck on my skin, and personally I didn't mind that because I was sick, and I at the time I wanted nothing but healing. So the fact that the medication is stuck on my skin, because I know that it's medication, I didn't have a problem with that. Even that squarish thing that I'm talking about that had the thick layer of the medication so that the bandage can come on top would even leave a print, because I had left it for long, that is overnight, and then I would remove them obviously in the morning when getting ready for work. But for me, I didn't mind that at all. So when I applied the medication for the first time, I would even feel like I was sweating. You know how your skin also feels like, imagine of extreme summer, is hot, you've just bathed, and then you apply something, even if it's an aqueous cream. This used to happen to me a lot when I was a child, I think when I was in primary. And a really hot summer, after bathing you apply cream and then you sweat, or a Vaseline, then you sweat. This medication did that, and I kind of felt better. I was like, I feel like I don't know what what medication has to feel like on eczema, but when it did those things, I kind of felt better, that okay, I think I'm getting closer to my healing. And even upon applying this medication for a couple of days, I recorded an update on my TikTok, and I said I don't know much about eczema, like I'm saying, obviously, and I don't know much about my healing journey and how it's gonna come. All that can only be revealed by God. But I said, simply because this medication helps me with combating the dryness, I know and I understand that I stand a little bit chance of getting better, because I know that my skin is now going to get a full break from cracking, from breaking, from those things that would look like sores and wounds and all of that. And indeed that happened. Immediately when my skin got nourished and got enough moisture, the cracking stopped and all of that, and the wounds then went down. I feel like that is when my skin then started healing. So I received this medication on the 2nd of January. I refilled it on the 16th of January, and also on the 29th of January I had refilled it, meaning in 1 month I had used 3 containers. This is my 3rd container that I really am trying to take care of, because there is also this baby in the picture, so we are going to unpack this baby also separately after this one. So the first container, I was so desperate. I think it's safe to say that I wasn't using it. Honestly, I was abusing it. I mean, I received it on the 2nd of January. Imagine on the 16th of January, when I went for my first consultation with Sister Maureen and the team, they refilled my medication because it was already gone. It was done. So I think I just exploited them there a little bit though, thinking that they're giving me medication for free, so I should just misuse it. I'm kidding. It's because for the longest time I felt so much relief and I got excited to shower, honestly. So I'll shower in the morning, I'll shower when I come back, and then the medication will just finish so fast. And remember, they were saying I should apply a thick layer of it. All right, so now this is my 3rd container. I am still using this as my everyday cream that I use for the dryness. All right, it still works like magic. So then let us talk about this baby. Forget about this writing outside. This writing and the contents of this container is not one thing. So it's not like this name that you're going to see out here is the name of the medication that is inside. No, it's absolutely not. So then what happened is early February, because I refilled my last container, which is the 3rd container of Ilusan, on the 29th of January. Early February I traveled to Lesotho, and at this time my Ilusan was completely finished. No, it was about to be finished. So I took a small lip balm, and then I took all of the medication that was in the container into that small lip balm. So you can just imagine how small the medication was. I then traveled with it. During this time, the flare up that I was experiencing on my face was out of this world. I'll insert a picture. There was a very heavy journey, very emotional. Up until today, I still don't know how I traveled and how I made it through that journey. I then traveled, low self-esteem, low confidence. I was not feeling well at all, emotionally, physically, mentally. I was just pushing through because that errand needed to be run right there and then. So I traveled. Fast forward, when I got home, I went to run this errand in town. This is Masero in Lesotho. I went to run an errand, but I got into KFC. When I was there, a lady approached me. She asked me, "Baby, is this eczema on your face?" I said, "Yes, mama." She said, "My child had this. Can you please?" Then she directed me to a certain pharmacy to say, "Go into that pharmacy." No, it's not a pharmacy, so it's a chemist. Go into this particular chemist, and when you get there, tell them that obviously you have eczema. A miracle happened when I walked in through that door, guys, for the first time in that chemist. When I walked in, there was a guy who was obviously standing on the other side of the counter, who turned out to be a pharmacist. His name is Professor Mahanya. He said to me, "I can already imagine how you look like without eczema." So he gave me a diagnosis just right from the door. And at this point, I had so much attitude because I felt like I had lost hope, to be honest with you. To me, it just felt like, obviously, you're jumping from one medication to the next and nothing is happening. Even with the Ilusan at that time, remember, this was my 2nd container, and at the time I traveled, I had ordered the 3rd one, which is this one that I have in my hand. This is why the 2nd one was almost finished. So I knew that it was helping me with the dryness. However, I still didn't have much hope that it was going to help me combat the symptoms that I was experiencing and actually get to restore my skin. So that is where the hope, the source of hopelessness came from, that I feel like I'm just rounding in cycles and nothing seems to be working. So when I got there, the guy said to me, "I'm going to give you something," and then he took out a medication. The name of this medication, I'll insert a picture. It's named clobetasol propionate. And I asked him, "Is this medication a steroidal medication?" I was afraid at that time because I'd used a lot of medication, which some of the medication was steroidal medication. And he was honest with me that yes, it's a steroidal medication. And then I got so scared because I had read somewhere and I had watched a video of somebody saying that a steroidal medication is actually going to make you worse. It will heal you faster, but then the side effects, they're going to be 10 times harsher than the eczema itself. And I was so scared. So when he said that it's a steroidal medication, I immediately gave him so much attitude. I don't want this medication, let's stop this, I just want something that is gonna be 100% natural, what. He said no, however we can dilute this medication. So then I said, oh, okay, wait a minute. Yes, it might be that I don't know much about eczema, and yes, I don't know much about the medication because I'm not a pharmacist. However, I do feel like if something is concentrated or something has a certain level of strength, if you dilute it, if you say you're going to dilute it, it means you're reducing the strength. More especially because at that time my hands even were open, you know. I will insert a picture of how I looked like. I was not looking okay. My skin had deteriorated so much. It had many open wounds. It looked like I was burned. And to think of applying a steroidal medication on that, I thought, no, I'm going to get worse. But then when he said that, immediately I said, okay. Then I got interested to understand, what are you going to dilute it with? So then he mentioned E45 cream. I said, no, please don't do that, because I had used E45 cream and it did not help me anyhow, guys. He mentioned Epimax. I said, no, I don't want any Epimax. He mentioned I think there's a purple lid, there's an orange lid for kids, for what? I said, no, I don't want that. All of the IQS creams, the IQS soap, don't tell me about those things. I've been there, I've used them, nothing worked for me. Shock me, give me something new. Indeed he did. He pulled out the other emulsifying cream. Most of the emulsifying creams have names. That one did not have a specific name. Indeed, it was just named an emulsifying cream. Then he said you're going to dilute it with a 500 gram emulsifying cream, and then he added also castor oil to use it as a binder. 500 cream would be this container. I just want to show you. Yes, this Illusan container is 500 cream. He took all of this container, 500 cream of the emulsifying cream, and then he mixed it in this container, this big container, and then he added all of that steroidal medication. I will check the grams. It's an ointment, the tube medication, you know how it looks like, right? I will then insert the picture. He diluted all of it using the 500 cream of the emulsifying cream and then the castor oil, and then he mixed into this container. Guys, I'm gonna insert a picture of how my face looked like at the time. I got this medication, it was on the Tuesday, I remember well. It was on a Tuesday. I applied it by the end of that week on a Friday, because I had taken leave for Monday, for Tuesday, for Wednesday, because I had traveled. On a Thursday, I went to work. On a Friday, I started getting compliments that, hey, you're glowing, hey, your skin's changing, hey, you look beautiful, hey, you look like this. You know, my hands are still not fully healed. You can see that you can clearly see that something was happening, something had happened there. You can see the difference there. Here, this would be the part that gets affected the most, right here, 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 up until here. My fingers were not that badly affected. You see here, all of this part, you can still see, even here, you can still see different colors. I'm still struggling with uneven toned skin. I'm still struggling with hyperpigmentation and all of that. So my conclusion when it comes to this is that this medication works. It works, guys, when it comes to the dryness. It really works. Let me apply some right now. It really works. My skin felt relieved after such a long time. I don't know if you can see that shininess just upon me applying it. Can you see that? Amazing. What's in here? This emulsifying cream that Tlotliso, the pharmacist in Lesotho, was so confident about, saying that it's still going to help with the dryness. For me, no, I'm gonna give it 0 when it comes to dryness. It did not help me with dryness. but combating the symptoms, that's steroidal medication. Because yes, if you read a lot, you would understand that the some of the best in medication to fight eczema is it's cortisone, steroids. But that will be a separate video on its own. I will then talk about the other recommended eczema medication. I will also do a separate video talking about the misconception about eczema. We will still dissect this topic more and more, just so we can help people out there. So, but this is a steroidal medication. It works fast, guys. Like, yo, I will insert pictures of how I looked like and how I look like now within just a space of a week. Honestly, that was for me. That was my experience. Within a space of a week, I got to be fine, and I'm recording this video in so much, you know, in so much hope that it's going to help somebody out there, somebody who has lost hope, somebody who has lost faith, somebody who feels like they will never ever get healing or get help or feel better. Because like I'm saying, I don't think I'm healed. I just feel like this medication worked like magic when it comes to combating my symptoms. So if you want to know more about the medication, please reach out to me, or please leave a comment. I still don't have a lot of subscribers, so if you leave a comment, I'm definitely I'm about to see it. So just comment down below and tell me about your eczema journey, if you've had eczema before, and please tell me about the medication that you have used, and surely hopefully that can get to help other people out there as well. Hope you enjoyed this video. Let's meet on the next video. Bye, until next time, I love you.